Hello, everyone. Hopefully you're connected. This is Barb Cochran. I am the Associate Director for the Northwest Geriatrics Workforce Enhancement Center, and we're in a different room, so things may look or sound a bit different this time. In fact, I hear myself echoing over there. So we might need to put that on mute. Do you know how to do that? Just the speaker? Okay, we're going to try this again. Is it coming out? Okay, so we're not getting too much echo. All right. Okay, so just a reminder again that the two lectures that were postponed because of snow days are going to take place on March 19th and March 26th, same time. So hope you'll be able to join us then, even though it's going to be finals week and spring break here at UW. Just check in with your site coordinators for things like information about continuing education, the handouts, the evaluation sheets, and just a reminder, please, to if you are not able to attend one of the lectures but are really interested in it, they will be posted on our website. That's nwgwec.org. Usually they're posted within about 48 hours of the live presentation, and so you can pick them up there. There's no registration. You can access them for free. What you can't do is get them for continuing education on that website, but you can get them for continuing education at the end of the series. The whole series will then be recorded and offered for continuing education. Today, I'm really happy to introduce two speakers who I've worked with quite a bit, and they're two of my favorite people. Marigrace Becker is a Program Manager of Community Education and Impact with the UW Memory and Brain Wellness Center. She received her Master of Social Work from University of Washington in 2010 with a focus on aging and community organizing, working within senior centers, parks and recreation, and other nonprofit contexts. She's developed and facilitated a variety of programs that promote well-being and celebrate the strengths of people living with dementia. She champions in amazing ways community initiatives that challenge stigma and build understanding, and she's a member of the Dementia Seattle Stewardship Team, and she leads the Dementia Friendly Communities Project Team for the Dementia Action Collaborative, which is implementing the Washington State Plan to address Alzheimer's disease and other dementias. Also, you're going to be very lucky today to hear from Allison Boll, who is Human Services Coordinator with Seattle Human Services Department, Aging and Disabilities Services, which is the AAA Area Agency on Aging for Seattle-King County. Allison has over 5 years of professional experience in the Aging Network and an educational background in social work. Following her undergraduate education, she worked with older adults and families in post-acute and hospice care settings. During her graduate studies at the University of Washington, Allison was trained to implement person-centered practices in the Aging and Disability Network through a New York Community Trust grant. She applied this training when she joined Aging and Disability Services in 2014, and during her time there, she has coordinated projects to facilitate the successful expansion of the Information and Assistance Program. Allison's current role involves bridging geriatric healthcare and social services sectors through outreach, education, and training activities, and she was one of our vanguard primary care liaisons with the Northwest Geriatrics Workforce Enhancement Center, so a familiar collaborator for us, and so I welcome both of them. I do want to remind you to please hold your questions until the end, and when they come through the chat at the end, then I will read them off to our speakers. And today they're going to be talking with you about community resources for dementia. Welcome to both of you.
Thank you so much for that warm welcome, Barb, and thank you to those of you in the audience today in person and also remotely. Allison and I are so much looking forward to talking with you about community resources for dementia. Here's a brief outline of where we're headed. I'll start by giving a bit of context around dementia, kind of prevalence, and some of the context for planning for resources for persons with dementia, and some of the programs that are out there. And then Allison will move into talking about some of the broad-based networks for support, especially around family caregiving. So I'm sure many of us are very familiar with these kind of statistics around prevalence of Alzheimer's and other dementias. But we know here in the United States, over 5.5 million persons live with Alzheimer's or other dementias. And then beyond that, there's another 16.1 million Americans who are providing unpaid care to persons with dementia. Another person is diagnosed with Alzheimer's every 65 seconds. And with that, and with the age wave, we anticipate that the numbers of persons living with dementia will more than double by the year 2050. In this context, of course, we're putting a lot of effort, energy, and dollars into looking toward effective treatments and potential cures for neurodegenerative conditions like Alzheimer's. And at the same time, we know that there are, as we've just said, millions of persons who are living right here now today with Alzheimer's and other dementias. And so there's an equal push toward providing effective supports and services that can help people live well and have a high quality of life as they're living with dementia or as they're caring for someone with dementia. And this image up here, this is a man named Neil out of a senior center in North Seattle, living with memory loss, and he was part of a project communicating messages about living with memory loss, what he would want people to know, and he says, "I'm still here," in a recognition of our community members who live with dementia are still here and deserve these kinds of supports and services. So a bit of context around some of the national and statewide structures for planning for supports and services and community resources. Broadly speaking, in 2011, there was an act called NAPA, National Alzheimer's Project Act, and that mandated the U.S. Secretary of Health and Human Services Department to create and maintain an integrated national plan for Alzheimer's disease, alongside an advisory council. And that plan was put together and approved in 2012. It has a variety of different goals, as you can see, that focus on prevention and also support. And I highlighted one, focusing in on that community resource area, which is to expand supports for people with Alzheimer's disease and their families. So again, logically, we know it's important to support persons with dementia and their families who are living with dementia today, but also we have a statewide plan that says, yes, that's one of our top 5 goals. This is just an example. There's many, many strategies and goals within the National Alzheimer's Plan. Just one of the examples of one of those goals that focuses on resources. Strategy 3.B, enable family caregivers to continue to provide care while maintaining their own health and well-being through things like developing evidence-based interventions for persons with Alzheimer's disease, as well as making sure there are dementia-capable systems that are providing support to family caregivers. So across our nation, we have a plan, and now nearly every state in the U.S. also has a state Alzheimer's plan, including every state in the WWAMI region here. I'm going to talk briefly about our Washington State Alzheimer's Disease Plan, which I'm most familiar with. So ours came about through a working group that was mandated again through our state legislature in 2014. They came together, some government departments like Department of Health, DSHS, and others that were in the private sector, working together to create a plan to help prepare us for the growing number of persons with Alzheimer's and other dementias in our state. And our plan was approved in 2016, so still fairly recent. And this top 7, or the 7 identified goals in the Washington State Plan are here. I'll point out several of them that relate to our topic. Number 3, ensure the well-being and safety of persons with dementia and their families. As well as number 6, ensure dementia-capable long-term services and supports are available in the setting of choice. And also down the bottom, number 4, ensure access to comprehensive supports for family caregivers. So 3 out of the 7 goals are really focused on the idea of community resources for persons with dementia and their families. At this point, now that the plan in Washington has been completed and approved, there's a group that is implementing our state plan. It's called the Dementia Action Collaborative, and they've been working for the last several years now, focusing in on 3 different subcategories of health and medical, long-term services and supports, as well as public awareness and community readiness. And some of the products that have come out of that, I'll mention, and also just say that these are all available online if you're looking for any of these resources. But they produced a very popular dementia roadmap for family caregivers that goes through different stages of dementia, what to expect, how to prepare, and how to best support your loved one. We've also created a dementia-friendly communities fact sheet, as well as guidance around how to start different social programs for people with dementia, a dementia safety info kit, and there's also a legal resources kit that's in progress. So again, if you're interested in those kind of resources, they're free to download from the website, which is there at the bottom of the screen. Having talked about some of the national and state focus and planning for persons with dementia and family members, I'm going to talk now about the concept of dementia-friendly communities and some of the semi-grassroots kind of approaches to programs that help support people with dementia within their communities. The idea of dementia-friendly communities are, the concept is that all sectors within a community, whether that's a neighborhood or a city or a region or state, are working together to make sure that persons with dementia and their family members are respected and included within the community and can fully participate and contribute. And that can happen through things like making sure that there's dementia-capable transportation systems, making sure that healthcare workers understand a bit about dementia, making sure that first responders understand what dementia is and isn't and what to look for, making sure that just your average cafe or grocery store down the street knows, okay, this is a little bit about what dementia could look like and how I can be supportive if somebody with dementia comes in. Here's a couple quotes. These are 2 members of the Washington State Dementia Action Collaborative, living with memory loss, and quotes from them about what is a dementia-friendly community. On the left, Miriam says, a dementia-friendly community is where people care for people with dementia. The point is respect, caring. I live alone, but I have many friends in the building, and I tell everyone at some point, I have Alzheimer's, and they watch out for me. On the right, Bob says, dementia-friendly communities, to him, equal awareness and respect of persons with dementia and their caregivers to help us feel comfortable. There are people in the community where I go routinely, like Denny's or volunteering at the golf course, who are aware of my dementia. I'm treated with acceptance, patience, and respect. I feel good about it. And I think what I'll hone in about these 2 individuals in their quotes, they both mention that concept of respect. And that is foundational for dementia-friendly communities. If there isn't that idea of respect, that idea of that inclusion is a priority, you're not going to really be able to work forward toward anything else. So key foundation is respect. Another foundation around the idea of dementia-friendly communities is social engagement. And that social isolation can be such a prevalent problem and challenge for persons with dementia as well as their caregivers. So a lot of different communities around the world have focused on how can we create programs and supports that help people with dementia stay socially engaged. This is a woman also living with memory loss in Seattle who said, at one point my doctor told me, stay active and stay social. That's the best advice I've gotten anywhere. I'm going to move forward and now highlight some of those models for social engagement that you can find. Some of them are available around the world and some of them are more localized. And then I'll give some examples in a few other states outside of Washington as well. So one model that's very, very common, it's probably the most popular, maybe most well-known social engagement program in the community for people with dementia and their family members, is called the Alzheimer Cafe or Memory Cafe. And this is a very simple yet quite profound program. Typically happens once a month in a community setting like a cafe or coffee shop, library, community center. And it's a maybe hour and a half social gathering for people with dementia and their family members to come together with others who understand their experience and who won't be judging them or, expecting them to remember everything perfectly. There's that sense of camaraderie and connection. And it's not necessarily that they're talking all about, dementia is this, dementia is that, this is my challenge with dementia. It may just be they're talking about, my pet dog, or talking about this great cup of coffee I'm drinking. It's a chance to really just connect socially. This model started in 1997, and at this point in the US, there's over 200 of these once-a-month Alzheimer Cafe events, including about 20 in the Seattle area here where I'm at right now. But it's really a worldwide type of thing, and you can find a national listing of Alzheimer Cafe events at that alzheimercafe.com website. Just as an example, though, in Japan, there's over 2,200 monthly Alzheimer Cafe events that happen. So, as I said, it's quite worldwide. A couple quotes about Alzheimer Cafes and the purpose of them and the benefits that folks get out of them. This is from Bob, who I quoted earlier, and he said, Alzheimer Cafes are especially beneficial to people who have been newly diagnosed and their caregivers. As you interact with others, you can find out what they have gone through and learn what to expect in a friendly, informal atmosphere. So there can be some learning that happens, but it's not didactic. It's kind of through lived experience and sharing of what's this like for you? What's it like for me? Another quote, this is from a caregiver who says, the world of a caregiver can become very small. Friends stay more distant since they are doing other things you no longer can do with them. So to be able to go out for a great restaurant meal with a group of others going through many of the same things as you is really a treat. So again, simple concept, but really providing that ability to stay connected socially when it can be quite isolating to live with dementia. Alzheimer Cafes, again, I recommend you to that alzheimercafes.com website to take a look at what might be available in your area. And also, as I said before, the Dementia Action Collaborative produced a guide for how to start an Alzheimer Cafe. So that's something you can keep in your back pocket as well. There's not one near you. Next, I'll speak about what's called the Dementia movement, which was founded in the Seattle area, but is spreading now around the Puget Sound region. And these types of programs you'll find in other areas as well, in other states, which I'll mention in a bit. Dementia is a grassroots movement that's empowering people with memory loss and dementia and their family members to stay connected and active in the community. So how does this happen? It happens through dementia-friendly programs in community-based settings like cafes, those Alzheimer Cafes programs, for example, or like museums, libraries, parks, community centers, theaters, and more. I'll give you several examples of these kinds of programs, but if you look at the momentiaseattle.org website, you can see a myriad of different programs that are happening on a daily basis all around the broader Puget Sound region. So 3 examples. Here's one. This is a photo from a gallery tour at the Frye Art Museum, which is in kind of downtown Seattle area. It's a free art museum, and they have a commitment to making sure that they're serving older adults and especially persons with dementia. They host gallery tours that are specially designed for the strengths and needs of persons with dementia. And it's a small group kind of experience where the persons with dementia and their family members are invited to go through together. And the museum tour guide, he focuses in on a piece of work for maybe 20 minutes at a time and asks very open-ended questions like, what do you see that's happening here? How does it make you feel? So there's no right or wrong. It's very, very accessible. It's not quizzing people on, what date was this painted? Who's the artist? So meant to be very dementia inclusive. One woman who went through this program, I asked her early on, her name was Cece. I said, Cece, what do you like about going to the Fry for this kind of program? And she thought about it and she said, well, Mary, when I leave here, the museum, when I leave here, I feel taller, which I thought was a lovely way of communicating about something, that sense of, I mean, you can imagine what that might mean. I feel taller. I'm standing tall. I've been heard. I've been in a dignified setting. I haven't been in a place where people are poking at, what's wrong with me. So I feel taller. But it's just a chance to be out in a community setting, doing something enjoyable with a loved one, and also connecting socially. Another example, this is a walking group that happens at a zoo in Seattle. It happens once a week, and participants get together. It's run through the Alzheimer Association. They take a walk. They look at certain exhibits in the zoo. So there's some exercise involved. There's some cognitive stimulation involved of talking about what the new baby kangaroo is doing. And then they end with a social time in the cafe at the zoo. One care partner says, the social aspect of the zoo walks is our favorite part. It's a place where my husband can feel comfortable just being himself. And for me, the bond that has been created with other care partners has been a wonderful support system, and many deep friendships have been formed. I know one woman who started going to the zoo walk a couple months after her diagnosis. Her name is Alice. I asked her the same question of, Alice, why are you going to this? What do you get out of it? And she said to me, well, Mary, when I was first diagnosed, my family stopped talking to me. But she gestured around to the group. She said, these are my new family members. And I was stunned in that was she'd only been going to the walk for a couple months on a once a week basis and already felt that kind of support and connection to others in the group. So walking groups are another example of the types of social engagement programs going on. The last program example I'll give in this region comes from Taproot Theatre, which is in North Seattle. They offer improv theater workshops that are tailored toward persons with dementia and their loved ones and the strengths that are there. So thinking about kind of maintain strengths in dementia, I think about things like the ability to be present in the moment and the ability to have lowered inhibitions. That might be seen as a problem or whatever in medical settings, but when you're trying to do improv or any of the creative arts, having lowered inhibitions can be a great benefit and strength. This program came about, I'll just share a brief story, came about through a gentleman with dementia who was sitting around a support group that I was facilitating at the time, and he was talking about having difficulty coming up with the right word and how frustrating that was. And then kind of a light bulb went on for him, and he said, I have a friend that does improv theater, and I just wonder if there might be something in that for us, for those of us that live with dementia and have difficulty getting our words out. Maybe we could try something with improv and learn how to use our facial expressions or our gestures or just other ways of communicating. And that happened at a senior center across the street from this theater. And we went over to the Taproot Theatre and talked to the director there, and her mom had actually had Alzheimer's disease. And so she was quite willing to give it a try and ended up developing this now very popular and effective program using improv. And she's been training. The person that originally did it is now offering it in long-term care facilities as well as other community centers like Edmonds Center for the Arts. And she was just in Eastern Washington and Wenatchee 2 weeks ago training a bunch of other theater artists in how to do this process. So the quote up there, family members with Alzheimer's never lose their imagination. They are still a gift in your life when you are able to do things with them like improv that brings out the beauty in their mind. So I've talked about the museum-based programs, walking groups, as well as theater-based programs. And these were more in the Seattle area, but I want to emphasize that these kinds of programs are happening across the world and including here in the kind of Northwest and up to Alaska areas. Up here are just some examples that I pulled. I was just doing some Googling to see what else is out there. But for example, the Memory Cafe or Alzheimer Cafe model, you can find in nearly every state at this point. In Oregon, they have a program very similar to the Fright Art Museum's program called Art Now, where they also do specialty gallery tours and art making. They also have a community choir for people with dementia and their loved ones called Sing Here Now. Over in Montana, they also, I think they semi-recently started something called Art in the Moment. Very similar program. Again, museum, art discussion focused on open-ended questions that people can engage with. And then across the border in BC, they also have an intergenerational choir with, I think it's university students and persons with dementia, and they're doing some studies on that as well. So just some examples. And I'm going to wrap up just with this quote from Miriam, who I quoted before. She says, "When I was diagnosed, I made some choices about how I was going to live my life because I didn't know, and none of us know, how many good years we have left. And so I just started to do the things that I love to do. I went to lots of places. I met wonderful friends. There is life after diagnosis, and it can be really wonderful." And I think I like to leave us with this quote, just recognizing that, as she said, there's life after diagnosis. Life doesn't end at diagnosis. In fact, with something like Alzheimer's, people may live 2 to 20 years after the diagnosis. And so when thinking about the value of these kinds of programs and resources, it's really about putting the life into those years and making sure people can live as well as possible throughout the course of their disease. So with no further ado, I'm going to now pass it on to Allison, and she's going to be talking again about the network of supports for persons with dementia, but especially around family caregiving. And we're going to trade mics for 1 second.
Well, thanks for your patience during that transition, and thank you too for the generous introduction. I'm really pleased to be able to join this series again and provide information about some of the public supports available, not only to you folks as professionals, but also caregivers, older adults, and adults with disabilities. Hello out there to my colleagues at Aging and Disability Services too. Some of this information they may know, but I plan, as Marigrace did, to also bring it up a level so it's not just local, but can also be useful to those of you tuning in from other states as well. As Marigrace mentioned, I plan to focus a majority of my information and information about systems of support on supporting family caregivers. And there's a reason behind that, and it may be really obvious, but just recognizing that in all of the models of kind of community ground up programs, there's kind of a theme that I saw, and that's that it's not just an individual with dementia participating, but they're often participating alongside a family member, a friend. And that is because a majority of people with dementia are living in community, and somewhere between a quarter or 3/4 and 85% of them are supported by family member or friends who aren't paid to provide any particular care. So you'll come to understand in the course of the presentation that family caregivers are really the backbone of any system of support for individuals with dementia. So the best predictor and support we can provide is really making sure that the caregiver has the resources, information, and confidence they need to continue in that role. So that's where I'm choosing to focus majority of this discussion. Interestingly enough, as much as we know caregivers play a very important role, there are, for all those millions of people with dementia, there are family and friends caring for them, but about half of caregivers have no outside help at all, so they're not necessarily receiving a formal support or service. So only about 10 to 20% of them are using some formal service. Just to give you a profile of caregivers for persons with dementia, a majority of them are providing 22 hours of care a week. So, you know, that's, if you think about caregivers who are also working, it's a significant amount of work. They are more likely to provide care for 5 years or longer. So in terms of their caregiving role and the duration of the role, it's much longer than if someone, you know, had an acute illness and maybe needed intermittent care or care in the end of life. A majority of these caregivers are spouses or partners, and in particular, women caring for their spouse. There's some trends at play here too, one being that a majority of caregivers are themselves older. Again, you have, especially given so many of them are spouses, sometimes it's hard to tease out who's actually the caregiver because often, you know, their system of support is they're supporting one another. And I'll talk a little bit about the identity of a caregiver and the role too. But you know, it's not always as clear as your one person's the caregiver, but we're seeing a trend of caregivers who are older and also managing their own, you know, disease processes or illnesses in addition to supporting another person. And we are also seeing a trend with more men caregivers. So whether that's just they're more readily identifying as caregivers now, in addition to just changes in what families look like, I'm sure we could kind of make our own assumptions about why that might be, but anyway, it's a trend nonetheless. So just diving a little bit more deeply into what we see in terms of the health of caregivers and how they're doing, I'm providing information from Washington State as an example, knowing that these trends may be similar in other states as well. The reason why I'm choosing just to focus on Washington State is we have a mandated assessment tool that we use in Washington State to measure the stress, burdens, and uplifts of caregivers in our state. So not only does it kind of give us a better way to be able to target appropriate services for these caregivers, but it also allows us to better understand how they feel and how they're faring when they come to us, and also how then our supports actually impact their health and well-being. So I share this slide about the cognitive status of the care receivers among some screened caregivers to show that a majority of the care receivers have some suspected or medically diagnosed cognitive decline. And I share this because many people assume that caregiver stress and burden would be related to their actual activities, any behavioral challenges, what actual tasks they're doing. So if they're providing a lot of personal care for someone for some long duration, many people assume that stress is really as a direct result of the tasks, and that a caregiver's inclination to maybe look elsewhere, including a long-term care facility situation, is really based on the tasks and behaviors they may be experiencing. But in fact, the best indicator of whether or not a caregiver intends to place someone in long-term care is actually found to be identity discrepancy. So, you know, take spouses, for example. I mean, they see themselves as partners in terms of their perceived role and how they support one another. Many caregivers don't immediately identify themselves as caregivers, and the tasks that they're doing aren't really consistent with how they perceive themselves in the caregiver-care receiver dyad. Same is true for friends and other relationships. Many, you know, caregivers may be doing it out of a duty, a familial duty, or just really they see they need to step in, but many aren't necessarily identifying that point in time where, oh, suddenly I'm a caregiver. So it's really that discrepancy in what they're doing and how they perceive their role is found to actually be the primary source of stress and the best indicator of whether or not they'll seek placement in a long-term care facility for a care receiver. So when caregivers, start to understand, this is actually a different role that I'm playing, and both are true, they're more likely to seek out help and support and start to reconcile those two roles. And you'll see here a majority of the caregivers that we screen when they reach us from a sample, about 80% of them have some high identity discrepancy. So this is true for many people when they reach us. And so it just helps us think a little bit about where a lot of our supports and services can best support a caregiver. So I mentioned that that's the best indication of intention to place. And here we see, most caregivers, they come for support and help, and they don't want to seek an alternative placement for the person they're caring for. So given the current situation, nearly half of them say definitely not. I'm not seeking any different living arrangement for this person. But if the condition were to worsen and they look ahead at the trajectory of what they may need to be doing, you see that shift where, upon assessment, they indicate, well, maybe not, but it probably, maybe, depending on how it worsens. So in terms of thinking about our systems of support, they really need to be able to provide services, to help someone throughout the whole process and throughout their journey. It's not just about kind of one touch, one service, but programs that can really help someone see the future and feel, supported and like they can continue in that role and have the tools and resources they need to do that. So with that said, what does that actually look like in terms of how we use that information to provide services? And so I want to step back a little bit and talk about an area agency on aging and what that is. Barb introduced me as a staff person of an area agency on aging, but I recognize not many people know what that is. They may have heard the term, but I want to kind of provide a description of the landscape of aging services, including where caregiver supports fit in. So area agencies on aging were established at a federal level through the Older Americans Act. They're really designated to be the local on-the-ground organization, not only charged with providing actual direct services, but also planning and coordination. And I'll talk about what that actually looks like, but Marigrace mentioned some of this community planning that's happening. And so we're involved as a partner in all of that. So our charge is really to build systems that support older adults with disabilities, and their caregivers. There are approximately 622 area agencies on aging, serving nearly every community in the nation. They have different service areas depending on the populations, and so how many older adults, for example, are residing in an area. So some area agencies on aging cover multiple counties. So the area agency on aging I represent covers King County because we are population dense, but as you get into more rural areas, AAA may cover 5 to 7 counties. And in rural states, the state unit on aging plays that role. So it does look different from community to community. So I will try to provide the most applicable and transferable information to you, but really the parting information I have is where to look to find, supports and resources in your community and what you might expect and anticipate and what you can help introduce to caregivers that you encounter. So a majority of older adults may receive federally funded public services through Medicare and or Medicaid, but in terms of social support in the community, the primary vehicle that they're getting that support is through the Older Americans Act. And this happens through what we call the Aging Network. And so you may have heard kind of this terminology thrown around, and what I would say the aging network really means is, we have this federal landscape and funding. It gets transferred and passed down to the state unit on aging. But the AAAs, the area agencies on aging, are really kind of the on-the-ground local organization charged with actually implementing those services in their area. So we're involved in continuous quality improvement and planning processes to make sure the services we're funded to provide actually meet the needs in our community and are responsive to trends. So even though I will talk about a few core services that most AAAs offer, the way that they appear in the community may look very different depending on the landscape of that county or local community. But not every AAA directly provides as one agency every service. Our AAA in Seattle-King County is a great example of that, where we have a network of nonprofit agencies who have actually, some of them have been providing these services longer than the Older Americans Act even existed, or that longer than area agencies on aging even existed. So in terms of the aging network, we're also referring to those nonprofits and actual direct providers of the services. And digging a little bit deeper, I want to make sure we don't lose kind of the volunteers, coalition, and grassroots programs, especially given, the information Marigrace shared. We may not directly fund those services, but certainly they're a part of our landscape. They're a part of the supports that are available. So our planning processes and the information that we do provide, that should be part of what we're knowledgeable and aware of. So sometimes we're a connector more than a direct service provider. So I mentioned that there are some core aging network programs and services. I won't go into detail about all of these. I'll focus more on the National Family Caregiver Support Program. But as in the course of discussion, you'll realize a lot of these other services are helpful to caregivers, even if it's not under the auspices of a family caregiver support program. If it supports the person with dementia or, caregiver benefits from it, it's still support. So supportive services encompasses information assistance, transportation, say to nutrition sites, and sometimes that's also transportation to other sites. So in our community, we have shuttles that take people to different locations, in addition to nutrition transportation, and adult day services. We partially fund some of the adult day services in our communities. The takeaway about supportive services is the AAA role as a focal point entity. So every AAA either is directly or contracting with an entity to provide a toll-free kind of clearinghouse where anyone, including professionals or an eligible client, can call seeking information or answering their questions. So we're a public entity, and in that way, we try to be really unbiased and be aware of all the resources available and really start with where the person really is finding that they need support. And, are they able to follow up on their own to arrange that service, or do they need a partner with an advocate in person? So many AAAs also offer in-person assistance, someone that could sit down, help someone navigate the complex systems and fill out applications. In some communities, this is now provided through Aging and Disability Resource Centers. Those could be part of an area agency on aging or a Center for Independent Living. So folks tuning in from Alaska, you have an Aging and Disability Resource Network that if in terms of wanting to connect people to resources and information, that's where you can be looking. You could think of the two, not always as interchangeable, but if you find one, it's a no wrong door system, essentially. The other core service that area agencies on aging provide is nutrition. So that includes home delivered meal programs, whether that's through Meals on Wheels or another provider, and congregate meals, which are group meals at some site, could be a community center, library, senior center, where an older adult and their care partner can attend, get a meal, and they're usually paired with some nutrition education or training. The other area is preventative health services, so that in our area, and many AAAs offer some kind of senior drug education program. that provides information about medication or coaching around medication issues. Health promotion generally looks like classes or workshops. In Washington State, with the benefit of the University of Washington here, we have a lot of evidence-based health promotion classes. You know, group-based classes are pretty much best practice for those things. So it's often groups of up to 20 folks, either doing strengths, aerobics, balance exercises to be stronger and prevent falls or feel more confident after a fall. So it could be falls prevention or just fitness classes. Before I launch into talking about the caregiver support program, elder rights is another area, core area of the Area Agency on Aging. So that could include elder abuse investigations. So in our area, how we implement this is we have dedicated case managers that have knowledge about elder abuse and can work with clients around those issues. It also is through partnerships. So we work with the King County Prosecutor's Office. And most AAAs actually house a long-term care ombudsman in their agency. That's not true here. So again, these are the core areas, but how they actually appear in your community may vary. But just to give you a sense of the scope of the services that Area Agencies on Aging provide, these services nationwide touch about 1 in 5 older adults. So there are many more who could benefit from the service, but we are reaching a great number. So I did want to focus more on the National Family Caregiver Support Program as a resource. This serves unpaid family caregivers as service recipients, and in some communities, it's not just blood relatives or family, it could also be neighbors or friends, but the paid or formal caregivers do have a key role too in our system, but this program is really intended to support the unpaid caregivers. It's administered through that aging network, so through the Area Agencies on Aging or those partners in the community, nonprofit agencies in the community. It's funded at a national level. The design in each community is guided by local and state planning processes. So this information that Marigrace shared about building dementia-capable communities and all of the community engagement that's happening, that does inform, you know, our overall program design at a local level. So just trying to connect, you know, that work with the work of the Area Agencies on Aging. And in general, the National Family Caregiver Support Program in each area is supporting some package of supportive services for those caregivers. So that includes that information. So whether that's brief information giving, referral, a connection to other partners or AAA services, access assistance, which is that one-on-one coaching of how to actually access one of the programs. So it could be in-person assistance filling out an application, or just assistance navigating. Because even the AAAs, as much as, you know, we are charged with planning, it's still a complex system. And even someone who has been professionally employed by them would be challenged with the situation in terms of knowing exactly what to do. So this is really about pairing someone with an advocate who can you know, support them in whatever they're able to act on or start reaching out to those other providers. But the other supportive services that are directly provided include counseling. In our community, that's in-home mental health counseling with the caregiver of some number of sessions. Support groups. Not only do we directly fund some support groups as an Area Agency on Aging, but we know that there are a number of support groups provided by healthcare organizations, hospitals, disease-specific organizations. So it's also about being aware of that landscape and connecting people to the support group that is most relevant in their situation, whether it's based on their relationship, so a support group for spouses, or specific to disease. So part of this is understanding what someone might most benefit from and what's really driving kind of their stress. Training, which is training not unlike some of those health promotion workshops for older adults. It's really about giving the caregivers the tools and skills that they need to feel more effective and confident in their role. In our community, there's an evidence-based training program called Powerful Tools for Caregivers. And it's just what it sounds like. It's powerful tools for caregivers to have to feel like they have the equipment and tools in their toolbox that they need to be in that role. And those are group trainings as well. So I would say one of the primary benefits is actually caregivers meeting other caregivers and understanding, hey, I'm not alone in this. And those feelings I had about not just, being a spouse, but also providing, care. I'm not the only one, kind of struggling with those feelings. Respite care is another area that we'll just talk a little bit more deeply about near at the end of this presentation. But this is break for the caregiver, whether that's in-home respite care through a home care agency, also includes out-of-home respite through an adult day center. And I'll talk a little bit more about informal respite. I really don't like to use that word because it makes it sound lesser than formal when actually it could be more beneficial, but networks of, community centers, recreational activities, things that can give the caregiver a break if someone was accessing them, really. And supplemental services are really flexible funds that we can use to purchase equipment or services that benefit the caregiver. They may be goods or services for the care receiver, like a bath bench, but if that bath bench wasn't there, that means that the caregiver is going to have a more difficult time providing bathing or other personal care. So in turn, it does benefit the caregiver. So those would be things that we would look at as part of this program. So who is actually eligible to receive these services? In most communities, it's those unpaid family caregivers, 18 and older, of older adults. Some areas, including Washington, have expanded to include any caregiver 18 and plus, 18 and older, of any adult 18 and older. So it really just depends whether it's the local community who's maybe put additional tax dollars into this program. In the case of Washington, it was our state legislature. And so it allowed us to expand our eligibility. But generally, it's family caregivers who are adults caring for an older adult. Also, family caregivers of individuals with Alzheimer's disease and dementia of any age. And grandparents and relative caregivers of children. So there's kinship caregiver support as well. And that's another trend, just to call it out and name it in our community. So the impact, in looking back at the profile that I shared of caregivers of persons with Alzheimer's disease and dementia, the program is reaching them, but not in great percentage or quantities. So nationally, this program it reaches less than 1 million caregivers, and we know many more of them are out there. So it's not to say that there's a lot of resources to reach every caregiver, but really the primary issue is identifying caregivers and helping, coach them towards seeing the benefit of accessing support, seeing that they don't need to feel guilty for maybe feeling stressed by the role, but that they can continue in that role with support for longer. So we've learned some things at a national level about caregivers. I wanted to kind of point out one national evaluation that took place, which included understanding caregiver outcomes in particular. So what we've learned, kind of unsurprisingly, I guess, one of the primary challenges for caregivers is stress, but also not enough time for self-care. So that's really where you start thinking about respite. Respite care may not allow a caregiver to go to work and have, some paid time, some paid care for the person they're caring for, but they don't even have time to maybe go to their own appointments, let alone, massage therapy or another class or something that they enjoy. And the third most challenge is the financial burden of providing care, whether it's sacrifices they had to make in terms of work or actual resources now that they need to pay to make sure that the in-home support's available. So the AAA services that caregivers have indicated they need the most, respite care is number one. So they need a break. They need someone who can come in and either supervise, provide some of the support for IADLs or ADLs. But also caregiver education and training ranks high up there. But I want to just call attention to these other supports. So when I mentioned why kind of describe some of these other core services of the Area Agency on Aging, it's because they too are services that caregivers benefit from, whether it's services then they know that they can connect the person they're caring for to, and they may not be directly paid for or provided by the AAA, but we act in a linking way. And one of the key findings in this evaluation is the relationship between the National Family Caregiver Support Program service use and other services. So we've actually found that people find the Caregiver Support Program through other Area Agency on Aging services. So they don't immediately identify themselves as caregivers and seek out caregiver support. Most of these caregivers are finding that support program through other programs. So they may have gone to a congregate meal program and been introduced to the caregiver support program. They may have gone to a workshop in the community and gotten an introduction to the program. So that really emphasizes not only the importance of some of these other services and just that immediate connection and coaching, but I think that there's an opportunity there to really do more education. I think caregivers, they can access other services. It could work both ways, basically, but most caregivers are accessing services through another program, or they're gaining access through another program. Most of the caregivers, 74%, 75%, reported that those services enabled them to care for much longer than they would have otherwise, and 88% of them said that those services allowed them to be a better caregiver. So thinking about that training or support groups, so learning from other caregivers. And over half said without the services they received, the person they're caring for may be in a nursing home. So they would have sought a different living arrangement. They would have sought long-term care placement for that individual. So at a national level, based on surveys and self-reported information from the caregivers, has been found to be effective in terms of its goals of helping that caregiver remain in that role for longer and delaying the need for long-term supports and services. But I do want to draw attention to feedback that the caregivers directly had and shared, and they specifically were kind of surveyed and invited to share some kind of suggestions for other caregivers. This was a group of caregivers who their care recipient had passed away. So kind of retrospective, what would you think is important to share with other caregivers or professionals? And first and foremost, they mentioned that finding resources and support earlier in the process would have been more beneficial rather than waiting for a crisis or waiting until they're in a different phase of caregiving where, maybe the stress was just really that much that they did have to, it brought them to a point of requesting help than they may otherwise have. So just in thinking about, the caregivers you see, they may not seem stressed or indicate or say that they're stressed. But if we can introduce them to some of those other Area Agency on Aging services or other services in the community that can give them or prime them and at least give them some connection to community, so they may be more likely to be introduced to the program, that would be beneficial. And unsurprisingly, caregivers who use respite and home health and get in-home support, they have a more kind of positive caregiving experience. And to me, this really kind of is connected to that identity discrepancy. So if they're able to be in the role that they want to be, doing the things that they identify more closely to their actual relationship with the person they're caring for, it's a more positive experience. So if they can really just focus on being a spouse, a friend, versus providing a lot of personal care, for example, and if they're able to care for themselves, they have a more positive experience. And lastly, but really not least, is the focus. They want people to find natural and peer supports in their community. So really thinking about some of those models of programming that Marigrace mentioned earlier, those are ways that caregivers can be connected to one another. So finding those supports, not everyone will find them from their family. So whatever that support network might look like, really working to understand, the caregiver and where they get their support from. This is really important because in terms of respite care, as much as I said how helpful it is, there aren't enough resources to give everyone in-home home care aid to give them a break nationwide. And we face a workforce shortage as well of home care aides who can provide the care that's needed for in-home care. So when we talk about respite care services, I really want people to be thinking about alternatives to in-home care, which is what most people immediately think of and maybe more comfortable is to have someone come to the home. But adult day services are really underutilized and could have an added benefit, someone going to the community, getting social support. There are many different models of adult day services. Where adult day health is concerned, they may be more of a medical model with physical therapy, occupational therapy, but there are also recreational and social models for adult day. You can find those through the Area Agency on Aging, or I think there's a national adult day resource. So figure out what, if you are working with a caregiver and know and understand them, what might work best for them. Do they really need that social support, recreation, or does someone need supervision from a skilled clinician? But also think about volunteer programs, recreational programs that, whether it's the care receiver and caregiver going together, but in a group setting where maybe the caregiver has a bit of an opportunity to socialize and maybe in turn feels like it's a bit of a break, or recreational programs where, the care receiver may be able to attend on their own if there's enough of a structure there, depending on the person's needs. So I just wanted to call that out because the reality is without more funding, we are going to have to do more problem solving. We're not going to just be able to say, yeah, you can get on home care by a home care aide. We're going to have to think about other options, but the need really shouldn't be what drives us. It should be what's best for that client, that caregiver, and the care receiver, and more of a group-like social setting actually would have an added benefit than isolated care in the home. And I I know I shared a bit about cognitive status in our program when we screen caregivers, and there was a study that compared the MMSE scores of folks in the statewide Medicaid long-term care waiver program, COPES, with who we were reaching with respite. And we actually saw folks, the care receivers in respite had much lower scores than those in the long-term care setting, long-term care service program. So this is just, I think, again, bringing us back to that family caregivers are really the backbone of our long-term care system. And they're providing a lot of the same tasks as the paid care providers in these waiver programs. So really emphasizes the need for training, support, to think about how can we support them to do that for as long as they would like to. And I don't need to talk too much about this, but the program has saved money as well for the state. So it's much more economical than providing care in a long-term care waiver program or setting. So how do you actually use this information and find what's available in your community? There is a national elder care locator site that's supported through that aging network structure in the Older Americans Act. So this is a public resource, and so it can be trusted information. So if you were to search in your area, it would not only turn up what is the Area Agency on Aging, but it would show the Aging and Disability Resource Center, the Long-Term Care Ombudsman Program, Adult Protective Services. So some of those other key kind of public contacts you would need to have in your area. So this could be a good starting point for you if you really don't know where else to turn or look for, or if you're coaching someone else to do some research in their community as well. But I don't want to neglect to mention some of these other national resources, such as Alzheimer's Association, many local chapters. I think not in every community, but they do offer a 24/7 helpline, even for communities where they don't have necessarily a local chapter. In a lot of communities, they're offering support groups or even in-person care consultation, but great wealth of resources and tools online. AARP, great information and guides online for caregivers, and then Veterans Administration has a caregiver support program as well. So generally, as an area agency on aging, we partner with the VA if someone has VA benefits. Those are really the benefits we try to connect them to if they wish to be in that system. That's it from me. So that leaves us 25 minutes, correct, for questions? I think that's good. So I'm going to invite Marigrace up here. Disconnect this. We'll share the microphone.
And while you're preparing that, I actually already have a question, and that is if they could see the intention to place slide again, which I think is number 29. The person said the colors weren't clear, and they wanted to be sure they're clear on the percentages per section.
Oh, great. And I can only see what it looks like in front of me, but I'm glad to summarize what the slide is showing. So upon screening, some caregivers are asked, given your current situation, if they intend to seek placement for the person they're caring for. And in this first pie chart, 43% upon screening said definitely not. 33% said probably not. 15% said probably would, and 9% were at the point of definitely would. Where's that information? And that's what they were really seeking support for. And I see this a lot, even just locally in inquiries of people saying, I can't do this anymore. Can you provide information about, an adult family home, for example? Upon assessment and screening, people are asked if the condition worsens, what their intention to place is. And again, these are screenings and assessments of the caregivers. In this second pie chart, 31% said they probably would, 27% said probably not, 20% said definitely not, and 22% said definitely would. So you see kind of the probablys and definitelys increase when someone starts thinking about doing this for a longer duration or with the kind of different needs or tasks that they may have to fulfill.
So hopefully this is like, I guess, like spectrum. But as like the population gets older, there's a growing number of this population as well. Is there any, or do these programs help out with homeless that are dealing with memory loss?
Oh. Do you have a starting point? I'm glad to start too.
You can start if you want to. I'm just not going to person.
Okay, so in terms of the area agencies on aging, if that's a local need and trend, that's part of our role is to try to, build a system that's responsive. What that looks like in our community, we have a lot of those information assistance providers, who may be based out of senior centers, providing information to people that come through their doors, or they're doing outreach to identify them and provide information, and may do work to help find someone if they have the resource to find, a long-term, living environment where maybe then they can have their other needs met too. But the network of information and assistance is really available through anyone here and kind of that drop-in basis. But there's a level of outreach and engagement that we do. So it happens in a continuum too. There's certainly case management that we provide for folks too, but we may not always be the primary entity doing that. So those partnerships are really key in a local community. So that doesn't really clearly answer your question, but it is to say, If that's a need in the community, it will look different in terms of how, we approach it. But a level of information giving and assistance navigating is available to any eligible client.
And I'll just add, I don't have much to say beyond that, but I do know another person who's really interested in that topic, which is at the School of Nursing here at University of Washington, Anita Souza, last name Souza, has looked a lot into dementia and homelessness. So she might know more and be an interesting person to talk with.
So one of the sites just mentioned. Okay, one of the sites just mentioned that the AARP is another resource that helps people in their community get connected to services that they need.
Yep, AARP is also a great starting point. And really what I think about, even from the perspective of an area agency and aging staff person, it's what is recognizable and trusted source of information for the individual you're working with. And if AARP is that resource, encourage them to start there, because that means they're going to be more likely to actually either follow up on the referral you're recommending, or, it'll just be more trusted information that they feel that they're getting. And AARP is a close partner of ours, and they do a lot of great community programming too, in terms of like movies that folks can come out together. So a caregiver and the person they're caregiving for with dementia, they might do movie showings where people can go. So a lot of great kind of recreational and social activities they organize too for their members. Do you have anything to add, Marigrace? Okay.
So I'm also getting a couple of questions about slide 21, and two things, wondering what COPES is. I think that's a Washington State program, and also explain about respite serving higher levels of cognitive impairment.
So COPES, I'm not familiar enough to know if that's available in other communities or if it's called the same thing, but basically it's one of the Medicaid waiver programs. By waiver, I mean someone isn't getting that personal care in a nursing home or long-term care environment, they're getting it in the home. So different states have different levels. They use Medicaid dollars differently. In Washington State, we've gone through a rebalancing where we're providing more of that support in a home setting versus nursing home setting. So COPES is just one of the terms, and I think even that now has changed to a different program, but it's one of those Medicaid waiver programs for people who meet functional and financial eligibility to get personal care. So really the significance of that slide is, someone who has significant enough functional needs to be receiving those services through Medicaid in the home. Those folks that are screened on the cognitive assessment actually screen higher than folks getting care through the state, the public family caregiver support program, which really should be the starting point. So really it's just to say that unpaid family caregivers are providing same, if not more, resources and personal care. So just the significance of their role and the role that they play in our long-term care system here. I hope that answers the question. If not, I'm glad to take follow-up.
Any other questions in the room? I don't have any other questions. Any other questions from the sites?
One more question. So with the programs that you mentioned, how likely are people with dementia or memory loss people, or is it aging, or is it like targeting the caregiver to help, or how does that work?
That's a great question. And it's a big range. Oh, sorry. Yes, that great question was for the community-based programs, things like Alzheimer cafes, walking groups, museum programs. How likely is the individual with dementia going to want to just attend, or maybe be self-motivated to go and seek it out? Or how much is it persuasion of the caregiver to encourage them to attend? Is that right? And yeah, I would say it's a range. There, at least with the programs that I'm familiar with here in this area, there's certainly people with mild cognitive impairment and dementia that are seeking out programs like that to say, hey, I want to stay active, I want to stay engaged. Like the woman, Mary, that was up there that said, my doctor told me, the most important thing my doctor told me was stay active and stay connected. She certainly is one who would have been on the internet searching out for these programs and wanting to go, feeling like it feels good to be social, but also it's healthy. So there are folks on that end of the spectrum. And then there are some who I'll hear from a caregiver saying, yeah, this sounds really great, but boy, my partner or adult father, whoever, definitely would not ever go to a program like that. He never has been social. He doesn't want to go to a cafe and talk with people, especially not something that has to do with dementia. So yeah, I see a wide range. And I think some of the programs, because there is that stigma around anything that has to do with dementia. Some of the programs, like the museum program, it's not like out there like, we are the dementia museum program. It's called Here Now. It's called like part of the creative aging programs for the Frye Museum. And when you go through the program, they don't say, oh, welcome, person with dementia, you're here for the dementia program. It's very much like there's an understanding maybe from definitely from the facilitator that persons here have dementia, but it's not ever like overtly mentioned or focused on to say like, you have dementia, what do you think? It's just, we're here, we're having a program that's accessible to people with dementia, but it's not like called out. So that can also help people feel more comfortable who maybe wouldn't otherwise feel comfortable showing up for something where you feel like you have this label on your head of, I have dementia and that's why I'm here.
No, just again, it really is dependent on the person and, what their interests, values were even before diagnosis or when you encounter them. And so it's not going to be one size fits all in terms of approach, which is why I really wanted to share also a variety of information, because whatever is going to get even that dyad, one of them connected to some support and services will be useful. So just try to find, the one thing that does, speak to them and it seems like could be introduced as a starting point, because there's a lot of myths too about services. So certainly adult day services, there's a lot of myths about what it actually looks like. So what can we do to start to bring people out to see, oh, maybe this isn't what I expected it would look like. Senior centers too are challenged too to kind of break down the myths and barriers of people, not necessarily identifying as a senior. So so just think about the way that you can get someone just out and maybe demystify some of these programs.
So I just wanted to mention Robin Ruff said that Sheridan, Wyoming has an excellent program in dementia-friendly Wyoming. And another question is there caregiver training online for those who live in remote rural areas? It's a great question.
I believe some local area agencies in aging do offer their training online. And I wonder, I think Powerful Tools actually does have an online module. Our local AAA doesn't, directly provide that, but it is a model and a practice in terms of online forums that caregivers can use. So really encourage you to reach out to whoever that resource you know of in your community. If there's one of those that I described that is recognizable to you, to ask them to look into that. Are you aware of anything directly, like a specific program? Yeah.
Mm-hmm. Okay, I think that's all the questions unless there's others. I think that's all the questions. Oh, here, Alzheimer's Resource of Alaska does have an online program, I guess.
Oh, great. There are a lot of experts I recognize, not only here in the room of people who do know specific programs, but certainly audience. I really appreciate people sharing with others too from the audience.
Okay, I think that's it. Thank you so very much for this great information.